you see in the healthcare business or in the healthcare industry in general for the year of 2024?
So finance would probably be the number one, and also the impact of technology. And I think we're
Introducing ALOIS Talks, Episode 3.
Good morning, good evening, everyone. Welcome to Episode 3 of ALOIS Talks, where we talk about the changes in the staffing industry, the main pointers of the staffing industry, what's going on in the industry, with who's who of the industry. And today we have somebody with over 15 20 years of experience in healthcare staffing market. She has, traveled through various places, did lot of work in this space, and would be the right person to answer a lot of query for us. And she currently heads the healthcare business, the client services part of healthcare business for ALOIS. She is the Senior Vice President Client Services for ALOIS Healthcare, Betsey Carges.
Thanks.
Welcome, Betsey.
Thank you.
Betsey, before we start, I would want you to, sort of introduce you, take us through your journey in this industry, how you, traveled through, various job roles and came into this industry, and how was it like?
Well, it was a journey. So I have a degree in education, and learned after about 4 or 5 years of doing it that was not my passion or calling. Loved children, but it was just not what I was meant to be. And so I went into a sales position and realized that was something that I really liked to do, that I had some talent with. So I did that for a little while and met the wife of a VP of sales in 2006. And it was a business interaction, and she said, "You should talk to my husband." So I did, and that's how I started. I'd never heard of travel nursing before, or travel allied or anything, and that's how I started my journey in 2006. I started as a recruiter. I've did, you name it, I've kind of done it. I've done some locums, I've done account management, I launched and was part of launching an MSP. I've sold MSP to healthcare clients, and then just have gradually transitioned to where I am now, 18 years.
Yeah. And in these 18 years, you've seen a lot of changes.
Drastic.
Drastic changes in the industry. A lot of, things that are happening.
Mm-hmm.
So in terms of healthcare service providers, right, according to you, how do they navigate through these challenges that are boiling down, right? I've asked this question to, a lot of speakers earlier as well. There's a lot of economic turbulence going on. Mm-hmm. And what are the key aspects or strategies that they should do to overcome the challenges that they're facing?
Mm-hmm. Well, I think the most important thing about with caregivers is that they are giving care to people who are at times are really in not just the person who's ill, but their families, and some of the most vulnerable times of their lives, and some of the most joyful when you're talking about like birth and death and critical illnesses. So keeping that at the forefront of our interactions with them, and as you think about them, we're providing them as a service. So who cares for the caregiver, right? So helping them to navigate life, and as an employer is key in understanding that they're going through some really awful things sometimes, and meeting them where they are and allowing them space to talk about that sometimes, or just making sure that they're able to meet their career goals, and keeping those things in mind is really important. Back when I was a recruiter, I would just say, what's your list of places to go, and how can I make that happen for you? And we would talk about the motivations behind that. I mean, caregivers are people just like us. You have a list of things you want to accomplish in your life, and they're the same. So just, I think you have to give them a little bit more space to really think about what they deal with on a daily basis, though.
So, to sum it up, it's all about caring about the people,
Yeah.
caring about the people who cares for people,
Yeah,
and that's really nice. That's really nice.
yeah.
So, when you are hiring those caregivers, you said you were a recruiter in your previous stints. Uh, so, when you are hiring those caregivers for any particular role, be it permanent position or be it a contractual position or a traveling position, right? So, for healthcare service providers, what is the advice that you would want to give it to them?
So, be thoughtful about where you want to work as it relates to your career goals. Whatever your motivation is, primarily it's compensation. Obviously, you can make a little bit more money, but also some places people just, they might want to travel. When I was a recruiter, I had a nurse who said, I want to drive my car through a redwood tree in California. And that was on his list, and I made it happen for him. Like, he had a list, it was on his bucket list. Like, how cool is that to make that happen, both on the client side and as a recruiter? And I'm still friends with, that was like 2007, I'm still friends with him to this day. Those are the type of relationships that I built. But yeah, you want to just think about how you can navigate and keep in mind like your personal life, so you're able to maintain relationships with people. Where you're going, is that going to be in line with where you want to go next?
Yeah.
And because where you work one place can impact where you go next, because your experience matters. And also, some people just want to travel because they don't want to be involved in hospital politics, or, they may even be motivated by some sort of desire to give aid to a place that really needs help. So maybe think like more of an inner city area or really underserved populations. So people's motivations vary, so you just want to make sure that you have an opportunity to fulfill that for them.
So basically, you bridge gap between the requirements, demand,
Yeah.
and also the motivation to do
Yeah.
that.
Yeah.
So it's wonderful. But you talked about your friend or the candidate who would wanted to travel through
Yeah.
California. You worked in several states, right?
Mhm.
And there's a lot of regulatory compliances.
Yes.
And it's very tough to handle healthcare related
It is.
regulatory compliance. So I come
Yeah.
from an IT background, and there's HIPAA policies that applies to
Mhm.
any product that we develop in this space. And I know it's a a little bit pain
Mhm.
for us to travel through it. And when it comes to healthcare staffing related compliances and regulation, it varies from states to states.
It does.
And how do you go through it, and how do you ensure that it becomes seamless for both the care providers as well as the healthcare service providers?
Mm-hmm. So this is kind of a two-part thing. So there is the state regulatory compliance thing. So we're required by some states to have a nurse agency license or a staffing agency license. So we have a team of people headed by our VP of Clinical, Jacqueline Neely. Jacqueline is involved on an industry level with an organization of nurse leaders that impacts that. They're involved in some advocacy with state governments as well. But her and her team work tirelessly on those applications, and then there's reporting requirements that go alongside of that too. And the other side of that is the contractual side. So client contracts have an element of requirements around regulatory things, either on a state or federal or local, based off of their funding or their billing. There is also, like in the past year or two, we've had like phishing attacks where like malware has come in and taken over a healthcare system's IT or their EMR, and it's shut them down. So there's regulatory things in contracts that we have to comply with around just safety and security of information, speaking to your IT background. And there's also like cyber insurance that we're required to carry to make sure that if there was something that happened, that we would be able to cover something like that. Ideally, we would never, but I mean, it's it's bigger than just regulatory. There's also a contractual side to that too.
So I'm glad that we do take care of all those
Yes.
measures. We take all the measures to ensure that nothing goes bad,
Yeah.
and the care providers, sort of get peaceful environment to
Yeah.
provide care.
Well, it's even our internal IT security because we house their PAI and PHI. And I mean, as an employer, you have to make sure that you protect people, right? They're giving us their immunization records, they're giving us a physical. I mean, you want, like, if you were doing that for ALOIS, you would want to know that that's secure, right? That's not information you would want
Sure.
getting out. So, just you want to make sure that all people feel comfortable and secure in knowing and trusting.
This is something that I've heard it from the founders as well.
Mm-hmm.
Data privacy and security is
Yes.
very, very of paramount importance to them, and they have ensured from the security safety aspect that all the stakeholders that are involved in the business, whose data are in the premise and or in the servers of ALOIS, they ensure that they provide them with the highest level of security. And yeah, it boils down from the top to the last mile.
Yeah.
And that's incredible. So it's 2024. There's a lot of things coming up, and ALOIS Healthcare is making a lot of noise in the market. What is the top unique challenges and opportunities in the healthcare business or in the healthcare industry in general for the year of 2024?
So finance would probably be the number one, and also the impact of technology. And I think we're also seeing more of a global solution. You're seeing, like, ALOIS is an onshore offshore company with a presence globally. We're starting to see a few more companies take that same approach, which speaks to the finance part for healthcare systems. They, for the past several years, they've had a unique situation of sometimes really high volumes, but they've also lost some of, like, the ability to bill, like, for their services because they were shut down. So there's and also staffing itself is a high cost. So just navigating that in a way that allows them to take care of the census of their patients, or the patient census, but also and get the right people there, the right talented people, keep the doors open, and also get back out of the red. So it's all basically around finance.
Great. So you also talked about the technology and its impact. So how do you think technology would impact this business, and how can we bring the positive change through technology for caregivers, care providers, healthcare service providers, to recruiters, everybody who are involved in the system?
So speed is probably the biggest factor that it can impact, and also quality of matching. So you want to make sure that we're getting the talent to the client as fast as possible. So you can use AI tools for matching. You can use AI tools for identification of, like, matching, identifying the talent, but also getting the talent there faster, and how, like, a profile is built with tech, or how systems integrate. So we have a system, and then the clients have a system that they use to post their orders. So making sure that is the fastest possible. Also, from a client perspective, there's things that we've done since I've started in October to make our profile look the best as possible, to have the best information and the easiest way to read possible. And our tech has helped that happen. Like, I had a vision of what we wanted it to look like, and we were able to work with our tech systems to make it happen, and that's been really cool to see. It didn't take months. It literally just was like, okay, this is what I want to see, and they were like, okay, here you go.
That's fantastic. So Betsey, thank you so much. That was a last question that I had, and you gave pretty much lot of information about the industry in general. There are a lot of insightful data that I can take back So thank you so much for your
You're
time. It
welcome.
was a pleasure talking to you, and I hope to see you soon in another episode of ALOIS Talks.
Thank you,
Thank
Akash.
you
I
so
appreciate
much.
it. Thanks.
Thank you.